In this video, we'll discuss about papillary carcinoma of thyroid. We are talking about thyroid gland carcinoma, that is malignant condition of the thyroid gland. Malignant condition of thyroid gland. And here we are talking about what? The papillary carcinoma of thyroid. So basically there are many carcinoma of thyroid like papillary carcinoma, then follicular carcinoma, medullary carcinoma and anaplastic carcinoma. So many type of carcinoma are there. Papillary carcinoma is the most common one. Papillary carcinoma of the thyroid. It affected FE and P. P stand for papillary causing thyroid. FE stand for it affected females. So the cell of that origin here, follicular cell. So follicular cell are the cause here. Then you have papillary pattern. That is why called papillary carcinoma of thyroid. Then it have good prognosis. Inside thyroid gland, some papillary structure. Suspect papillary carcinoma of thyroid. It is very common. It is a malignant condition because it is carcinoma. It is coming from follicular cell. What you will see here, it will present as asymptomatic solitary nodules and cervical lymph nodes. The regional lymph nodes can be involved. So basically these will be asymptomatic. They won't be any pain. There will be this one, solitary nodules, multifocal nodules. There will be lot of OZ, multifocal and regional lymph nodes can be affected. Local metastasis or regional metastasis is very common in papillary carcinoma of thyroid. Sometimes thyroid tissue itself can be presented in the lateral cervical lymph node. Sometimes it can presented in lateral cervical lymph node. So the natural cervical lymph node, you can find the thyroid tissue, that is what called as lateral aberrant thyroid. What is lateral aberrant thyroid? Means the thyroid tissue is in the lateral cervical lymph node. The cross of papillary carcinoma of thyroid, the cut surface of enlarged thyroid gland shows a single nodules. It shows a single nodules separated from the rest of the thyroid parenchyma by incomplete fibrous septa. The nodules is grayish white, soft, showing the crossly visible papillary pattern. Even crossly able to see papillary pattern. The morphological features of CRAF. The morphological features of CRAS, what we should know here, it is solitary multifocal lesion. The lesion will containing fibrosis and calcification. There are often cystic and they can be up to size 10 centimeter in diameter. And when we cut it, we can see grayish white hard scar. Like why hard here? Because there is calcification fibrosis. So obviously it will be hard and sometimes it can become into a cyst. So that we can call it papillary cyst. Adenocarcinoma of thyroid. Then microscopically look this diagram. So this is the normal thyroid tissue. You can see here follicular cell, then inside colloidal in that center. So this one is the normal thyroid tissue. We can see this one is the follicular cell. So this one is follicular cell, then center it have colloidal. Now we can see that papillary architecture. This one is the papillary pattern. Then we have a kind of clear cell. See here, kind of clear cell is presented. It is called ground glass appearance. Here we can see lot of calcification and some moma bodies. This one is the some moma bodies. Then lot of blood vessels, center having nucleus. So here we having that nucleus, they have grooves like coffee pattern, grooves inside, they having grooves. So here like a coffee bean. Intranuclear inclusions also presented. Papillary pattern, fibrovascular, scald covered. This is the notes. This is the microscopic appearance, notes format. Ground glass or optically clear appearance. Then orphan annii nuclei. So here nuclei, how it is present, orphan annii nuclei. In addition, investigation of that cytoplasm may in cross section give the appearance of intranuclear inclusion, pseudo inclusion, or intranuclear grooves also presented. Then this samoma bodies, half of the papillary carcinoma, notes typically small, concentric, calcified things, name is called samoma bodies in that stroma. Then capillary carcinoma of thyroid having variant. Okay, so this one having variant, few variant of papillary carcinoma of thyroid. What are the variant? Follicular variant, tall cell variant, and diffuse sclerosing variant. Follicular, tall cell, and diffuse sclerosing variant. We already known prognosis is good. The survival rate is 95%, 10-year survival rate, 95% 10 year. Then it is related to radiation. Any maximum exposure to radiation, there will be high risk to papillary carcinoma of thyroid. Genetic alteration they have mentioned. What are the genetic alteration? Red gene overexpression or NTRK gene rearrangement. Then regional metastasis is very common. What is regional metastasis means? Occur when cancer spread to nearby lymph node. Okay, so nearby lymph node it can spread, nearby lymph node or tissue, but remain within the same region of the body. That name is called as regional metastasis. So this is all about papillary carcinoma of thyroid. Thanks for watching.